You would go for another one if it were to be offered, say?
It was necessary, yeah.
I'm old and I needed the protection, so I did.
I haven't found any place to do it yet, I just haven't got round to it, I must admit. Yeah, I'm going to get it.
No, I haven't had, I had the one before, but I haven't had this one yet.
And so why have you just not got round to it? Or?
And I haven't had a letter. I'm waiting for a letter.
Interesting point. Well, Dr Helen Wall is the NHS lead for immunisations in Greater Manchester. Of course, it applies across the whole of the North West. I spoke to her a little earlier, and I asked her first about that point made by the final chap about not receiving a letter inviting him for a booster.
You know, you don't need a letter. I know some people think you do, but you really don't need a letter. If you think you're eligible, if you meet the eligibility criteria, or even if you're not sure, please go to one of the sites that do vaccines. Loads of pharmacies, loads of walk-in sites. Turn up, tell them you think you're eligible. They'll go from there. And the first woman I think we heard from in that clip said she didn't think she was eligible because it was only over 50s. Who is eligible for this booster? Yeah, so there's two parts of the booster that I'm ending on Sunday, the 12th. The first part is the autumn-winter booster, so that's anyone over 50, so that lady was right in that sense. Anyone under 50 with long-term health conditions, any unpaid carers, health and social care workers. So that's the first group of individuals. The second group of individuals that may be eligible for a booster is those 16 to 49-year-olds who are otherwise well, don't have a job, that means they need to be vaccinated, but they were offered a booster in 2021 as a third, so they had the dose 1, dose 2, and then everybody in that category was offered a booster. That offer will also end on Sunday. So I think that lady said she'd had 3 vaccines, so she probably was up to date and where she needed to be in terms of having all of her vaccines. We asked for questions from people earlier on. Lots of people have been in touch, as you'd expect. We'll go through these as quickly as we can. Yeah. Lisa, just more of a practicalities point, really. She had to contact her GP to get the booster. She's worried she would have been missed if she didn't contact her GP. I mean, it's a valid concern, isn't it? I mean, we've done over 144 million vaccines in the country since the programme began, and over 17 million winter boosters. As I said before, you know, if you think you're eligible, don't wait to be contacted. Don't wait for your letter. Turn up at one of the vaccine sites. There's loads of walk-in sites. Go in and ask. Yeah, and do it before Sunday. Yes. The second point to Lisa's question was she's got a 16-year-old son who's had 2 jabs. He says he doesn't need a booster and he's fine. We find this a lot with young people. As you go down the cohorts, people feel like they don't need that booster, and I think it's everybody's individual, choice. And it may implicate things like travel. So some places still want you to have had that first booster for travel. I'm not sure how patients are going to get that if they don't have it by Sunday. Anne has said her husband had a deep vein thrombosis 90 days after his booster. He had nothing after any other vaccinations in his life. Is there any evidence of post-vaccine deep vein thromboses with the COVID jab? So all vaccines, all medications can cause side effects like this, but 90 days is quite a considerable amount of time, and it's really hard for us to prove any causality. So I can't, I don't think we can say that that's caused that 3 months later. It's a long period of time in between. Ruth had trouble getting a home visit for her mum. She's in her 90s, she can't get out. The GP says they'll come, they'll do a home visit, but they haven't. What's your advice to Ruth? There is a 119 number where you can ring if you're unsure about how you can access a COVID vaccine or want some advice. Ring 119, they'll be able to give you some advice. A couple of brief ones. Anne's son has ME, doesn't have any specific conditions listed for the booster. Are there any plans, she says, to offer it to younger people with disabilities who are not on the list? Well, she doesn't say how old he is, but if he's over 16, it is a clinical decision. So I think if she's concerned that he is at risk, I think it's worth going along to one of the vaccine sites and having that conversation with a clinician there, because there is an element of clinical discretion. 2 quick ones. John, he's 77, he's had all the jabs, he wears a mask in public. Is there anything else he should do? He doesn't want to catch it. The key thing is not mixing with people who you know are unwell. So if you know people have got coughs and colds, perhaps stay away. And a final one from Lillian. She's similar to John. She's doing all the right things. She wants to have a spring booster. She says, is there any news on when or if spring boosters will come? Well, no certainty, I'm afraid. We're working towards the assumption that there will be. Our teams are prepping sites for that on that basis, but we have absolutely no confirmation that that's going to go ahead, so we need to watch this space. But if you want to get a jab and you want to get it done, you need to do it by Sunday. By Sunday, please, yeah. Dr Helen Wall, as always, thank you. Thank you. Hope that was helpful. Now, many people enjoy a pint of beer at the end of a hard day or maybe at the weekend, but there is a warning